Hello guys, this is Lily and welcome to my YouTube channel. This video will provide you with some test questions and answers that will help you in your massage therapy review for examination purposes. So, question number 1. What type of joint is hip joint? Okay, so there are choices. Letter A, ball and socket biaxial, meaning two sides, and B, ball and socket triaxial, 3 sides, and C, ball and socket uniaxial, 1 side, and D, pivot joint triaxial, 3 sides. So the correct answer is letter B, ball and socket triaxial. Okay. So I have here some notes to explain about this kind of joints. Okay, so there will be I will be discussing about the types of synovial joints, because the joints we are talking about deals with synovial joints. Okay, so the types of synovial joints, you have the diarthrotic synovial joints, can be subdivided based on the number of axes, okay, around which they permit motion to occur. Okay, so there are 4 categories, which is the uniaxial, the biaxial, the triaxial, and the non-axial. So these categories can be further subdivided based on the shapes of the bones of the joint. Okay, so for the uniaxial joints, okay, there are 2 types of synovial uniaxial joints, which is the hinge and the pivot joints. Okay, for the hinge joints, it acts similar to the hinge of a door. Okay, so one surface is concave and the other is shaped similar to a spool. Okay, so flexion and extension are allowed in the sagittal plane around the mediolateral axis. Okay, the humeroulnar elbow joint is a classic example of the hinge joint. Okay, so take a look at this picture, guys. So that's the elbow. It's a hinge joint. See, it's compared to the door. Okay, so just take a look at it. The hinge of a door. So the down drawing. Okay, so you flex, move it up towards your head, and you extend, move it down towards your leg. Okay, elbow joint. For the biaxial joints, there are 2 types of synovial biaxial joints. Okay, the condyloid and the saddle. Okay, so a condyloid joint has one bone which surface in concave. Okay, and the other bone's surface is convex. The convex surface of one bone fits into the concave surface of the other. So flexion and extension are allowed within the sagittal plane around the mediolateral axis, and abduction and adduction are allowed within the frontal plane around the anteroposterior axis. Okay, so to antero towards the front, posterior towards the back. The metacarpophalangeal joint of the hand is an example of condyloid joint. Okay. Okay, guys, take a look at this example, this drawing. This is an example of the joint in the hand, a condyloid joint. Okay, as shown on the drawing. You have here the drawing. Just take a look at it. Drawing A and drawing B. Okay. Now, for the triaxial joints, okay, there is only one major type of synovial triaxial joint, which is the ball and socket joint. Take note of this, guys. There's only one major type of synovial triaxial joint, the ball and socket joint. Okay, as its name implies, one bone is shaped like a ball and fits into the socket shape of the other bone. Okay, a ball and socket joint allows the following motions. So flexion and extension in the sagittal plane around a medial lateral axis. Abduction and adduction in the frontal plane around an anteroposterior axis. And medial rotation and lateral rotation in the transverse plane around the vertical axis. So take note of this, the planes. Okay, sagittal plane, you have to know what sagittal plane is, and the transverse plane, the frontal plane. Okay, you have to familiarize with this to get familiar with this triaxial joint, the ball and socket joint, the movements. The hip joint is a classic example of the ball and socket joints. Here you go, guys. So the hip joint is an example of a ball and socket joint. So take a look at these drawings, guys. You're going to see drawing A. Okay, example of a ball and socket joint. It's a hip joint. Okay, take a look at the movements. There are a few movements I have mentioned a while ago. Okay, so take note of these movements, guys. So pretty much is doing most of the movements, the ball and socket joint. Okay, so picture A, picture B, and picture C. Okay, so let me just show you the skeletal system, so at least you get to know, get to see the different kinds of, bones and its names, their names. Okay, so just take a look at this drawing, guys. From the head, I'm gonna show you up to the foot. Okay, okay, so from the head to the foot. So be familiarized about the location of these bones, okay, and their names. So I just showed you the frontal drawing of the human skeleton. Now I'm going to show you the back side of the human skeleton. Okay, and just take a look at the bone parts, its names or their names. Okay, this drawing will help you to locate or know exactly where the bones are and their names. Okay, from the head to the foot. Okay, there you go, guys. So just look at it. The second question is the question number 2. What is RMTAO in massage therapy profession? So what do you mean by RMTAO? Okay, the choices are letter A, it's a peer assessment. Letter B, examination distribution. Letter C, a professional association in promoting massage as a viable source of therapy. And D is a regulatory body of massage therapy profession. So the correct answer, guys, will be C. Okay, so take note, it's just a professional association. Okay, this is your cue, association in promoting massage as a viable source of therapy. All right, it's not a regulatory body. Okay, so I have here some information about RMTAO. So it is a professional voice of massage therapy. Okay, established in 1936, the RMTAO is a member-driven, non-profit association that provides leadership for and advocates on behalf of the profession. Okay, it's a non-profit association. Okay, that's your cue. It is not a regulatory body. Okay, it's just a professional association, non-profit. Okay, guys. Okay, so it exists in order to advance the massage therapy profession in Ontario. The RMTEO, so take note, it's only in Ontario. This profession is an association in Ontario. The RMTEO has worked to advocate on behalf of the profession and provide resources and opportunities to help RMTs, registered massage therapists, improve their knowledge, navigate the latest research, and grow their practice. Okay, so take note, guys, this is an association only in Ontario. Okay, so the benefits of membership. So just read on the information here, guys. Okay, so question number 3. A member or registrant may be reinstated if the member applies for reinstatements within, the choices are A, 1 year of suspension, B, 5 years of registration, C, 2 years of suspension, and D, the next credit cycle. So the correct answer here is letter C. Okay, guys, so just take note, 2 years of suspension for a restatement of a suspended registrant. Okay, so we'll move on to the question number 4. The complaints committee refers complaints to the following committee. So if there's a complaint about a registrant from the complaints committee, then this committee will refer the complaints to the following committee. So you have to take note of this. The choices are A, the Discipline and Executive Committee. Letter B, the Executive and Appeal Committee. Letter C, Patient Relations and Fitness to Practice. And letter D, Quality Assurance and Registration. So the correct answer here, guys, is letter A. Okay, so I have provided you some information and that will help you, determine the duties and responsibilities of each of the committees of the College of Massage Therapy of Ontario, CMTO. Okay, so for the council is the governing body of the college. Okay, this College of Massage Therapists of Ontario, the CMTO. According to the Massage Therapy Act of 1991 and the college bylaws, council is composed of, okay, you have to remember this, guys, 9 registered massage therapists, the RMTs, elected by their peers on geographical or academic basis. Next, up to 8 public non-RMT members appointed by the provincial government. Okay, take note of this, guys. Other information about the council are listed here, so you just have to read and take a look at this, guys. Okay. Next is the executive committee. So the executive committee has all the powers of council between council meetings, with the exception of making, amending, or revoking bylaws or regulations. So these are the exceptions that the executive committee cannot perform their other obligations, their functions. Okay, so they can function all of the council members' responsibilities or powers, but they cannot do making or amending or revoking bylaws or regulations of the college. Okay, the committee addresses and acts on matters requiring immediate attention between regular meetings of council. Okay, that's their function. The committee must report to council on any decisions taken between regular meetings and must report annually on its activities. Okay, so executive committee reports to the council. It's just a hierarchy of responsibilities and powers here, guys. So just, take note of this. So the next committee will be the Client Relations Committee, right? The Client Relations Committee is responsible for overseeing programs that encourage a commitment to continuously improving the professional relationship between RMTs, the registered massage therapists, and their clients. Okay, so this includes developing related education requirements and guidelines for registrants as they relate to prevention of all forms of abuse. Very, very important. Ensuring measures are in place to prevent and deal with sexual and other forms of client abuse. Okay, promoting public understanding of the college abuse prevention plan. Administering a funding program, providing therapy and counseling for those who were sexually abused while clients by a college registrant. Okay, so these are the functions of the Client Relations Committee. So you have to take note of all of these guys. Okay, so the next is the Discipline Committee, The Discipline Committee is responsible for conducting hearings related to allegations of registrants' professional misconduct or incompetence. Here you go, guys. So just, familiarize with the keywords, okay, of these committees, especially in your exam review, okay? You just have to take note of the important, functions. So you will know if it's which committee you are going to think about in answering questions. Okay, so as part of this process, where appropriate, the committee makes decisions about revoking or suspending registrants. Okay, so the revoking and suspension of registrants are the one of the functions of the discipline committee. Okay, certificates of registration. So registrant certificates of registration or imposing the other terms and conditions. So keywords, guys, okay? Now, when you see this committee, Fitness to Practice Committee, so the function of this committee, it hears matters concerning the physical or mental capacity of a registrant to practice. So keyword, fitness, means the mental capacity, physical and mental capacity of the registrant to practice. It's all about the physical and mental capacity of the registered massage therapists, the registrants, in their practice of massage therapy. Okay, so that's your keywords. Okay, it makes decisions concerning the registrant's capacity to practice. Okay, so decision. So whether the registrant or the registered massage therapist is capable to practice the massage therapy, profession, and where appropriate, orders revocations or suspensions. Okay, revocation or suspensions, or imposes other terms, conditions, or limitations on registration certificates. So they have this function as well, but the major idea of their function, guys, are all about the physical and mental capacity to practice of the registered massage therapist. Okay, that's the function of the Fitness to Practice Committee. Okay, now moving to inquiries, complaints and reports committee. So the inquiries, complaints and report committee, the ICRC. Okay, so just remember this, ICRC. I stands for inquiries, C, complaints, R, reports, C, committee. Oversees investigations, reviews, complaints from the public about registrants and determines a course of action in accordance with legislation, including referral to the discipline committee for allegations of professional misconduct, incompetence, or incapacity. Okay, keywords here, guys. So the ICRC committee are the one who are looking for, the registrants. They are the one who oversees, or they're the one who does the investigations or the reviews of any complaint from the public or the client to any registered massage therapist or registrant. Okay, and they're the one who investigates this and reviews the complaints. And once they investigate the complaint, they're gonna forward their findings to the discipline committee. Okay, so from ICRC, they're gonna forward it to discipline committee for any allegation of, we're looking at allegations for misconduct. Okay, any misconduct, incompetence. Okay, if you're not competent enough to do your job as a registered massage therapy, or you're incapacity to do your job as a massage therapy. Okay, so incompetence, incapacity, and misconduct. So they are looking for these three. The ICRC, once they have done their investigations and review, they're gonna forward their findings to the discipline committee. Okay, and it is also responsible for keeping the complaint and the registrant informed during the process. Okay, so they are the ones keeping the complaint, and they will inform the concerned registrant or the concerned registered massage therapist during the process of the investigation. Okay, the committee is required to complete the investigation and make a decision as to the outcome of each complaint within 150 days. So very important, guys, you have to take note of this, the number of days that this ICRC will be completing their investigations or their findings about any misconduct, incompetence, and incapacity of the registrant or the RMT, the registered massage therapist, as reported by the public or by any client. So if there's any complaint from the client, then the ICRC are the ones in charge for investigation, and they're gonna complete this investigation within 150 days. Okay, take note of that, guys, and they forward their findings to the discipline committee. Okay. So the next committee will be the quality assurance, the QA. Okay, so the quality assurance committee develops, monitors, and reports on the college quality assurance program. Okay, so quality assurance and then college quality assurance program. So there's the hint. This includes appointing peer assessors. Okay, so peer assessors, they're the ones who appoint these peer assessors for the program under the quality assurance program. So the quality assurance committee appointing peer assessors under the program, the quality assurance program, and referring any information regarding a registrant's potential professional misconduct or incompetence to the ICRC. Okay, so this is the reporting process. So the quality assurance committee are the ones who chooses peer assessors under the quality assurance program, and if they found out any potential professional misconduct and incompetence of the registrant or the registered massage therapist, then so by doing the peer assessment, okay, so these assessors will go to do peer assessment on a chosen registered massage therapist, and if by their findings, in their practice, they go to the clinic, they talk to the registrant or to the registered massage therapist, and during their findings on the notes, how the registrant keep their notes and stuff, if there are findings that about misconduct and incompetence, lacking information, the regis was not able to follow the protocols, the laws, what information, what needs to be done as a professional practitioner, a registered massage therapist, then the quality assurance committee will report to the next committee, which is the ICRC. Okay, the ICRC committee. Okay, so you just have to take note of this, guys. Now the next one is the registration committee. So the registration committee evaluates internationally educated applicants for admission to the certification examination. Okay, as well as other matters, including inactive registrants requesting a return to clinical practice, or applicants for registration who do not meet the criteria for registration set out in the legislation. So registration committee, their function are making sure that they approve of the of any applicant who finishes the practice or the massage therapy program and wanting to get admission to the college of as member of the College of Massage Therapists of Ontario. So they are the ones in charge for the all matters regarding certification examination. So if you finish massage therapy program and you think you are qualified to take the certification examinations, okay, the written exam, certification exam, and the OSCE, the oral practical exam, then the registration committee are the ones in charge for all of this. Okay, and it also includes if the inactive registrant wants to be returned to clinical practice, wants to return for practice, they're the ones who's in charge as well. And also for registrants who does not meet criteria for registration set out in the legislation. Okay, so those registrants who does not meet the criteria for registration. It also reviews requests from the registrar to impose terms or conditions on a current registrant certificate. So that's one function, additional function, guys, as well. Okay, so in fulfilling its mandate, the registration committee has a duty to provide registration practices that are transparent, objective, impartial, and fair. Okay, so these are the objectives, the goals: transparent, objective, impartial, and fair. Okay, so they investigate, they look into things if about the registrant, getting into the practice of massage therapy profession. So keyword registration committee, it's all about registration, getting into how you will get your license, okay, and how you will if you're inactive, you will be able to practice as an active practitioner, RMT practitioner. Okay, so those are your keywords. Okay, let's move on to the question number 5, which is which one of the following statements regarding the hypothalamic pituitary axis is false. Okay, so there are 4 choices. Letter A, the hypothalamus and pituitary glands link the nervous and endocrine system. Letter B, the hypothalamus and pituitary gland hormones affect a large number of body functions. Letter D, dysfunction of the hypothalamus glands affect the function of the pituitary gland directly. Letter D, hormone release factors, HRFS, secreted by the pituitary glands stimulate the hypothalamus. Right? So the correct answer here is letter D. So you're looking at a false statement, false answer here. So in the questions, guys, you'll find most of this type of questions. So you really have, it's very important. As a suggestion, you really have to read the question up to the end, up to the question mark, okay? Because most of the time, they're looking for the false answer, which is not the correct answer, okay? You will find this very difficult, or you will, you're gonna get a wrong answer if you're not gonna read all the questions. Just take your time in reading everything up to the end, up to the last word, okay? Up to the question mark, all right? So there are a few notes here for you to, for your notes or information to help you guide in this kind of, with regards to the terms that are used in this question. Okay, so take a look at this, guys. Just read on the information. What is endocrine system? It's all here. And the picture of the hypothalamus. Okay, so that's the hypothalamus. So you have an idea how it looks like. Okay, so what is hypothalamus? So there's an information here. Just read on this, guys. Additional picture for you. Just take a look at it. More information about the hypothalamus. So just read on this. And now we move on to the pituitary gland. Okay, so the information are here. Just read on this. What is pituitary gland? Okay. Now, a picture of a pituitary gland. As you can see, just look at this, guys. It has anterior lobe and the posterior lobe. That's the pituitary gland there. Okay, this is the little gland. Okay, pituitary gland, you have the anterior lobe. Information are here. Just read on this, guys. Very important. Okay, so here we have the types of hormones secreted by the cells of the anterior pituitary, the hormones secreted by the anterior pituitary gland. Okay, so we have the names of the hormones: a human growth hormone, the thyroid stimulating hormone, the TSH, human growth is HGH, the follicle stimulating hormone, which is the FHS, the luteinizing hormone, the LH, and the prolactin, the PRL. So familiarize all these, guys. So you have the name, the target area, and the function. Okay, so this information will help you. What are the target area of these hormones and the function of these hormones? Okay. We also have additional hormones: the adrenocorticopic hormone, the ACTH, the melanocyte stimulating hormone, the MSH. Okay, so their target area and their function as well. So let's move on to the next lobe of the pituitary gland, the posterior lobe. Okay, so the neurohypophysis. That's another name for the posterior lobe. Okay, so it says here, while the anterior lobe shoulders most of the work in producing hormones, that's the anterior lobe, take note of this, guys. It is the one producing more hormones. The posterior lobe stores and releases only two. Okay, take note, the posterior lobe only stores and releases two hormones: the oxytocin and the antidiuretic hormone, the ADH, or the vasopressin. Okay, oxytocin and ADH. Those are the only hormones that the posterior lobe releases and stores. All the others, it's the anterior lobe. Okay, so when you know of these two for posterior, then all the others are the anterior lobe of the pituitary gland. Okay, for the oxytocin, OT, aka the love drug, all right, oxytocin, the trigger, okay, and function. Just read on this. Anti or antidiuretic hormone, ADH, or vasopressin. Okay, you have to familiarize with these two because these are most common of the hormones. Okay. Now let's move on to the question number 6. A client has a sway back posture with their buttocks more prominent. Which of the following does this best describe? Okay, so A, thoracic lordosis, thoracic on the thorax, the rib cage area, lordosis, curve, abnormal curve. B, cervical kyphosis, meaning on the neck's area, kyphosis, like abnormal curve as well. C, the lumbar lordosis, excessive curve on the lower back, the lumbar vertebrae. D, thoracic kyphosis. Okay, so thoracic kyphosis is different from thoracic lordosis. So thoracic kyphosis is outward curve, okay, so of the mid back, the thoracic area, the rib cage area is like it's protracted. Okay, the thoracic lordosis is like flattened back. Okay, like towards the inside, inner. The kyphosis is outward curve or protraction. Okay, so the correct answer here is letter C, lumbar lordosis. Okay, we have here notes or information about lordosis, the cervical, thoracic, and lumbar lordosis. You just look at this picture and familiarize everything. Okay, take a look at this, guys. More information about lordosis. We have here the contributing factors, so just read on this, guys. Okay, it says here not every lordosis requires medical treatment. However, when the curve is rigid or fixed, medical evaluation is warranted. Okay, now let's move on to the question number 7. So where are pillows placed when patient is in supine position? Supine meaning face up on the client's back on the table. Why are they placed there? So the answer is letter A, under knees, to support low back, to rest on the table, and under head and neck if needed for comfort. Okay, so the correct answer is letter A. Just look at the other choices, guys, okay? Question number 8. What are the draping landmarks supine for anterior leg? Okay, the landmarks for supine for anterior legs. So supine facing up position. Okay, clients lying down on their back, face up. And we're looking at the landmark for anterior legs, so the front of the leg. So the landmark will be A, greater trochanter, or the anterior superior iliac spine. Okay, so those are the draping landmarks. So take a look at the other choices, guys. So the correct answer is letter A. Okay, so question number 9. What are the draping landmarks supine for abdomen? So we're looking at the abdomen area, okay, the stomach area, right? The correct answer is ASIS, or the anterior superior iliac spine, the xiphoid process. So where the at the tip, the middle of the breast area, you know, the vertebrae there. Okay, that's the xiphoid process right there at the lower part. Inferior sword-like extension of sternum. So the sternum is in between the breast area, right? So take a look at the other choices, guys. So the correct answer is letter A. Okay, here, so I have some information here. There's a picture of the hip joint here, okay? So you're gonna find the ilium, acetabulum, greater trochanter, the head, the neck, the lesser trochanter, and femur, the ischium, and the pubis. Okay, familiarize all of the names of these bones and joints. So I have this information for the few questions, about greater trochanter, about iliac crest. So just read on this information, guys. So the iliac crest, there's a drawing here to show you what exactly is the iliac crest, or where it is located. So these red marks here, that's what you call the iliac crest. Okay, information about the groin. Read on this, guys. Okay, so this is a picture of a pulled groin muscle. Okay, so just look at this to familiarize where exactly the groin area is. Okay. Now, next question, question 10. Where is the upper limb draping landmark in supine position? Upper limb, okay? The arm, the upper arm, okay? Supine, again, facing up on the table. A, the answer is under client's back at axilla level. Axilla is the armpit area, okay? So other choices, just take a look at this, guys. Correct answer is letter A, okay? Question 11. What is the draping landmark for the upper chest in supine position? Again, facing up position. The correct answer is under client's back at axilla level. Axilla is the armpit area. Okay, so correct answer is letter D. Just take a look at the other choices, guys. Question number 12. So what is the draping landmark for the back in prone position, face down? Okay, prone position is the client's lying on the table face down. The correct answer is posterior superior iliac spine. We commonly call it PSIS. It's the back landmark. Okay, PSIS, so posterior superior. And the correct answer is letter C. Just look at the other choices, guys. Question number 13. What is the posterior lower limb draping landmark in prone position? So face down position. Okay, lower limb, the lower arm. The lower limb means the leg, sorry. The leg part. Okay, so the answer is letter B, greater trochanter. Take a look at the other choices, guys. Correct answer is letter B. Okay, for question 14, when including the gluteals in a posterior lower limb, okay, posterior on the back side of the leg, lower limb is the leg side. Lower limb massage. What are your draping landmarks in the prone position? Again, prone position is facing down on the table. The correct answer is letter B, iliac crest plus the lateral border of the sacrum, the side of the sacrum, okay, the lower vertebral vertebrae of the spine. Now the correct answer is letter B. Just read on the other choices, guys. Okay, for question number 15, the anterior superior iliac spine is anterior, meaning on the front of the body. ASIS provides the draping landmark for which two massage areas or positions. The correct answer is letter D, anterior lower limb, the leg part. In supine facing up, plus abdomen in supine. So the abdominal area, the stomach area. In supine, face up as well. Correct answer is letter D. Okay, so question number 6. The axilla provides the draping landmark for which three massage areas in supine position. Okay, so supine position again, facing up. If the client is lying on the table, face up. Letter A, upper limb plus upper chest. Upper limb, the arms, upper chest, the chest area, the breast area, plus the head or the neck and shoulders. So you're gonna look at the draping landmarks. So correct answer is letter A. Okay. Now let's move on to question number 17. The question number 17, where are pillows placed in prone position? Prone position is face down, client lying on the table face down. Now, correct answer is letter C, under abdomen, so under your stomach area, plus under ankles, feet, or toes. So, another pillow on the ankle area. So, correct answer is letter C. Just look at the other choices, guys. Moving on to question number 18, why is it important to place a pillow under the abdomen in prone position? Prone position meaning the client is lying down, face down on its stomach, abdomen by the table. Okay, so correct answer is letter D, to support and relax the low back. So you place a pillow on the abdomen, on the stomach area, in order to support and relax your low back. You're supporting the low back area. Okay, now the answer is letter D. Now, let's move on to question number 19. Name the principle of massage which refers to the area of the body being treated. The part of the therapist's hand being used, the area of the body treated, the part of the therapist's hand being used, and the techniques being used. Okay, so area, the part of the hand, and the technique. So what kind of principle is this, guys? So the correct answer is general because of the area, as specific because of the part of the hand of the therapist being used, and general because of the techniques used. Okay, correct answer is letter A. You should be familiar with the principles, these 4 principles of massage, guys, because it's really part of the examinations. Moving on to question number 20. Which principles, okay, refers to the amount of pressure? Now you're dealing with pressure used, okay, your force used, and therefore the level of tissue, you know, the soft tissue, the area that that's being treated, that is being engaged. Pressure, that's your force, and then the tissue, how you know far you can go on to the tissue. Okay, so when you mean pressure use, that's your deep superficial deep principle. So the answer is letter C. Okay, keywords, guys. Pressure use, that's gonna be deep, superficial, deep. Okay, the next question will be question number 21. Name the principle that refers to the relative location of the work being done. Relative location of the work being done. So location, meaning which area. If you're looking at location, that's your cue. Which area? It should be the uppermost or the lower, the upper or the lower part area. So when you're talking about location, that's the proximal, distal, proximal principle. Okay, that's your cue, guys. The answer here is letter A, proximal, distal, proximal. Okay, so question number 22, which principle refers to the method of approach to a problem site? Method of approach, like pain, spasm, adhesions. Okay, so method of approach. So if there is pain, okay, or spasm, adhesion, so you're thinking of what principle are you gonna use? Okay, so you're looking at the principle peripheral, so towards the side. If there's pain, so you're not gonna touch the area where there's pain. You are going to move to the side, away from the painful area, okay, the problem area. Or central, okay, towards the middle if the area in the surrounding has the problem. Or and then peripheral. So the correct answer here, guys, will be peripheral, central, peripheral. So you're looking at the problem site. Okay, if there's pain, spasm, adhesion, so you're gonna do your treatment on, you're gonna apply the principle of peripheral, central, away from the problem area. Okay. Okay, so question number 23. The direction of the pressure is blank towards the heart. So remember this, guys. If the direction of the pressure is towards the heart, it's always centripetal. Okay, centripetal. Okay, letter A. So That's towards the heart is centripetal. Memorize this, guys, okay? Centrifugal, it's away from the heart, the opposite. Okay, so if you know of centripetal is always towards the heart, as most therapists do, then you can answer the other word, which is centrifugal. Okay, so correct answer here is A. Now I have here a note. You have to memorize the 4 basic principles of massage as we have discussed on the previous questions. Okay, so there are 4. We have superficial, deep superficial, general, specific general, proximal, distal, proximal, and peripheral, central, peripheral. I have discussed this on this video, so you really have to memorize this, guys. Okay, question number 24. Client comes in with a note from the doctor saying with mild biceps femoris strain. So biceps femoris, when you mention you get to be confused of bicep, which is on the arm, but when you see femoris means pertaining to femur. Okay, that's on the upper leg. Okay, right? Strain, pulled muscle. How would you confirm? Okay, how would you confirm the client has a mild biceps femoris strain? So the on the biceps femoris in the posterior or the back upper leg, how would you confirm that the client has this strain pulled muscle? Okay, a little bit of tear, if there's strain or not, but it's like pulled muscle. Now you're gonna do Thompson test. So you have to know what Thompson test is. B, active resistance range of motion, and C, Faber's test, and D, Eli's test. There could be other choices, but the answer here is active resisted range of motion. The correct answer is letter B. So active resisted range of motion, we have discussed this previously. So active resisted, so you're gonna ask, as a therapist, you're gonna ask the client to start doing the movement first on the affected area if it's the leg. So ask the client to move the leg towards the back by himself or herself first, and then you try to help or assist the client. Oh, sorry, you have to resist the movement. So you apply a little pressure on the leg, okay, on the posterior leg, or a little bit lower. As the client moves towards the back, you apply pressure against it, okay, and see if the client will have a discomfort or pain, complain of pain or discomfort. So once the client complains of pain or discomfort, that means it's positive for mild biceps femoris, the muscle strain. Okay, there's a problem in the area. So that's the correct answer, guys. Okay, so I have here some information about the choices. So for the Thomas test, it's the Thomas test that I have here. So it's a different test. It's a rectus femoris test as well. Okay, so that's a rectus femoris test, Thomas test. For the active range of motion here, so range of motion is ROM, is the measurement of movement around a specific joint or body part. So they have the types of range of motion. So any movement on the joint on any body part means range of motion. So there are 3 primary types of range of motion. So now there's the active range of motion, which we have discussed, which we are looking at to know the meaning of it. There is passive range of motion, PROM, and the active assisted range of motion, AAROM, or we commonly call this resisted range of motion. Okay, so I have discussed the active range of motion a while ago, guys. And you can see the other types, what passive range of motion, PROM, means, okay? And the active assisted or the resisted range of motion, so RROM. So this range of motion, guys, are very important. You really have to familiarize this and memorize the meaning of it, Okay, you can put your own words, you can find other, information about this, but it's just similar. You should know what it means by heart. Okay, for your written exam and your oral practical exam, this really will help you. Okay, so just be mindful. So we have here an information about testing your range of motion. So read on these dice. So information about the favors or Patrick's test. So just read on these guys. So know what Patrick's or favors test is for. It's the hip pathology or SI, sorry, joint dysfunction. So sacroiliac joint dysfunction. It's the hip pathology on any abnormality on the hips. So positive sign, be familiarized with these guys, okay? For the Eli's test, just know about this test. It's the contracture or hardening of the rectus femoris muscle, the one that we're located on the posterior or the back of the upper leg. Okay, so that's Eli's test. Now, moving on to the last question, question number 25. Standards of practice for consent. What is included? Okay, so the when you mean or when you talk about standards of practice, so the CMTO standards of practice, our practice standards for consent, it's about consent, client's consent. So you have to note of this information. The correct answer here is the opportunity for client to ask questions. Okay, you memorize this. When it comes to consent, when you are doing your assessment before the treatment, what consent means here in our standard practice is about the opportunity for client to ask questions. So you cannot proceed with your treatment without giving the client opportunity to ask questions and, agree upon with the treatment. Okay? So correct answer is letter D. So I have here a few information. I have taken this from the College of Massage Therapy of Ontario notes, so it's complete. So it says here the standard from the standard of practice compilation. Communication Public Health Standard. That's consent is Communication Public Health Standard 7. That's standard of practice number 7. Okay, consent. Okay, so take a look at this, guys. They have the condition, the task, and the standard. For the standard, you have the quality and technical, the policies, the quality interpersonal. So you really have to read and understand these guys. Additional information. And for the timing, okay? So it says that before beginning the assessment, reassessment, and or treatment, you memorize these guys for consent as well. It's very important. It appears in most of the exams in the massage therapy exam. So consent should be taken at the beginning, before beginning the assessment. So before you begin with your assessment, your reassessment, and or treatment, okay? So, like I said, the reference here is the Healthcare Consent Act of 1996, guys, okay? So that ends our video for today. And thank you for watching this video. Please like, comment, share, and subscribe. Okay, thanks again, and you have a great day.